Hi, I'm Ali. I'm one of the physios from treatmyachilles.com. This is part of our Sever's disease video series in which we have been talking about what Sever's is, what symptoms you might be getting, what causes it, what treatments you can do, and what other things can you consider. If you haven't had a look at the rest of our series, please go back and have a look at those ones before this, and the links to those can be found below. Today we're going to be discussing different types of footwear, and we're going to be talking about day-to-day footwear, footwear that they can use for sports, footwear that are the worst types, the things that are more likely to irritate it, and any little cheats, tips, hints, workarounds that we can give you to alter footwear that they have to wear or that you currently have without going out and spending a lot of money. We are treatmyachilles.com. We're an online physiotherapy service offering any kind of treatment and assessment for all types of an Achilles problems. If you would like to find out a little bit more about our service or have a look at booking an appointment, please take a look at the link below. So as we know from our previous videos, Sever's disease is also known as a traction apophysitis or a calcaneal apophysitis. So that is where the Achilles is irritating the back of the heel where it attaches because it's causing forces or traction forces to go through that growth plate, that calcaneal apophysis, and therefore that can cause irritation and make that area quite angry. It tends to go hand in hand with growth spurts and with active, sporty children. So what we know from this condition is that lots of the symptoms are based around where that Achilles tendon inserts into the back of the calcaneus. So that area can be quite tender and quite sore to touch. So one of the most common things that people tell us is that footwear is uncomfortable if it touches that area or puts pressure on that area or rubs on that part. So looking for footwear if you are going for sandals or shoes that have a back that's missing but with a strap that can go around the back of the heel above the area where that's rubbing can be very useful. Looking for shoes that have a higher heel to toe drop, so therefore the heel is higher than the toes. This reduces some of that traction force. So if you think about the calf turning into the Achilles and attaching into the bottom of the heel, if we hold it slightly up, so slightly in that higher heel to toe or plantar flexed position, and we're only talking a few millimeters to a centimeter here, in that position it just takes the edge off that traction that's pulling and it can be a lot more comfortable. So shoes that have a higher heel to toe angle, like wedges, on summer shoes, or it might be in sports shoes and trainers, those that have a higher heel to toe can be very useful. You also can buy heel wedges, and those heel wedges can sit at the back of shoes, and if they sit at the back of the shoes, they can lift that up. If it lifts it up, again, it can change where the back of that heel sits in the shoe, and therefore it causes it to rub less. The good news is with Sever's is that it can be very short-lived. It can be easily managed, and we're talking a few weeks here. So buying something simple or using the footwear that you have already can be very useful for a child. You also want to have a look to see whether that footwear has worn out. So some things to look for are your children collapsing, it's not giving them as much support as they have. If you look at the soles of the shoe, is there any kind of wear? So is there wear more on the inside of the heel or the outside of the heel, more wear over the inner part where the arch is or where the toe knuckles are? And if you can't see as much tread left in the shoe, or you can see one side's got lower than the other, it's probably time to change that footwear as they're not supporting your child as best as they possibly can. So day to day, can you have a look at higher heel to toe, buy a heel wedge, or have a strap that covers above the area and nothing on the back of the shoe around that part? If they do have old trainers that haven't quite worn out yet, Some people modify the back and the heel area just by removing some of the padding or wadding and cutting through, particularly if they're soft trainer type shoes, to give a bit more space. But what you don't want to do is change the structure and the support that shoe is given. It's just more for comfort. And again, an old pair is better because this is probably short-lived and going to go away in a few weeks. Part of the assessment for your child, we've mentioned before, is to look at what sort of foot position they have. So whether they have a higher arch or whether they have a flatter arch, a supinated foot, a pronated foot, or somewhere in the middle. And that might give us a clue as to what sort of footwear that might be more comfortable for your child. There are some different types of brands and different things that can be recommended for this, and you can find that in the information below. So then we come on to what are the no-nos? What are the ones that are more likely to irritate your child? So things that can be more likely to irritate are really flat, non-cushion shoes. So again, there isn't that heel to toe drop. It is quite flat. There isn't much cushioning, so it's not very supported. It's also not very easy to shock absorb. So things like your ballet pumps or certain types of school shoes that are quite formal and quite rigid. Are there ways that you can work around by getting alternative school shoes or talking to the people at school, any of the teaching staff that might be able to give you special discompensation for that short period of time that your child is symptomatic, to wear different footwear around the classrooms, or if they have days where they have a higher step count because they've got to walk around the site, or they have PE, for example, can they come and wear their PE trainers all day? These are the sorts of things a clinician can help you with, because we can help write letters or back you up with our notes and information that we send to you. So you can take those in to coaches of different sporting events or into schools, and you can then have a direct conversation with them as to why and how that might help your child at the moment. Other shoes that aren't great are the ones that mean that your child's got to work to keep their foot inside or holding on to that shoe. So things like a flip-flop where they need to grip and hold on with their toes, or a sandal that they've slid their foot into without any kind of back strap or strap over the top that can tighten or fasten it. Wellies can also be the same, particularly if they're quite loose fitting. Again, the child's foot can slide around inside. So can you do any kind of workarounds where you take an insole out of an old pair of shoes and add them into a pair of wellies to make them smaller? Double sock your child so their foot is a bit bigger, and again add that heel wedge that you can do to lift their heel up slightly. A good way of adding a heel wedge, if you don't want to stick it into the bottom of a shoe, if it's got a sticky back to it, some makes do, some makes don't, again, is to use that old insole out of an old pair of shoes, stick it onto that one, put it in the pair of shoes that they're currently wearing, and then once they don't need it anymore, you've not got a pair of shoes with a bit of something stuck in at the back that you can't take back out. Quite a lot of those different types of heel wedges or gel heel cups can be just removable, and you can take them in and out and put them into different footwear. If your child is getting changed for PE and they're a bit younger and are not used to just changing footwear and their heel wedges, buying a couple of pairs and putting them into PE shoes or shoes for outside of activities, and a pair for their normal school shoes or day shoes would be a useful idea. If you are buying gel heel cups or heel wedges or raises for your child, please put them in both shoes, the same height in both shoes, just to keep things even, keep that gait pattern, that walking pattern nice and normal and symmetrical for your child, just so you don't get any kind of other aches and pains anywhere else. If your child has to wear a certain type of shoe or has to be barefoot, can there be a workaround here where that is only for the shortest period of time? So could they walk to school in a pair of trainers and then get changed into their school shoes just for their classroom activities, and then get changed back into trainers to walk back home again? If they're doing sports or activities that require particular shoes and footwear, like your dance-based activities with ballet pumps or barefoot, or indeed more rigid shoes like your football boots and rugby boots where you've got a bit more of a firmer heel. Are there times where they can take those out if they're not on the pitch or training, or can they wear something a little bit softer on certain occasions if it's training and not in a match play situation? Again, depends on the sport and the safety of your child on what surface they're performing that activity on. Can you have, again, adding in that heel wedge, but not just now for the height. You can also buy ones that are a bit more cushioned and shock absorbing. Sometimes they're the gel wedges. And again, they can cause the more rigid type shoe. They can make those feel a little bit more cushioned and a little bit more comfortable. If they're doing an activity where they would be in these types of footwear, can they limit the time that, if they can't change the footwear, can they limit the time that they're on their feet? So when they're listening to instructions, or they're not part of a drill, or they're sitting out a certain type of that activity, which comes to editing your different sports and activities that Marika has spoken about during this video series, you might be choosing to pick some drills and not others. Can they not have them standing? Can they not be doing any other activities on their feet? Can they be perching on something, take a chair with them and sit on that, or do other activities? For example, if you're gymnastics, can you do floor-based activities where you aren't standing necessarily while the other things are going on? So as a general summary for this area, your best sort of footwear is ones that are supported and cushioned for your child, depending on their foot type. It's also ones that have a higher heel to toe drop to reduce the irritation of where that Achilles is pulling on the back of the heel. It's ones that may not rub on the back of that heel, so less of a rigid structure at the back, or you've put something in the shoe to raise that heel ever so slightly higher. Can they be in more cushioned shoes for longer periods of time that are more comfortable for them, or have a load off their feet when they don't have to be in the shoes or footwear or bare feet that tend to irritate them? This is just one component to the treatment of severs. If you were just to change your child's shoes, the odds are they're still going to get some sorts of symptoms when they play sports and activities. That's why it's important to have a look at our section on relative rest and managing and editing activity to help calm this down, as well as all the other types of treatments, exercises, stretches, strengthening, mobility work and control work that your child needs to do. Therefore, it is important to speak to a practitioner to get their advice on the best footwear for your individual child. This gives you some suggestions of different types to look for and can have specific brands in the information below.